You might have noticed people in America are mad. And I'll tell you why they're mad. They're mad because they're scared. They're scared that their mothers in nursing homes won't get the care. They're scared that their children with disabilities will be wards of the state because they won't, as a family, be able to afford to take care of them. They are afraid that their pre-existing conditions will no longer be covered and they'll have to file bankruptcy to stay well and to afford their insurance. They're afraid that we're going back and that we're going backwards. And when people are afraid, they're angry, it is absolutely essential that we respond with leadership, that we respond like the adults we're supposed to be in Washington, D.C., and that we do the work that we're supposed to be doing in Washington, D.C., and that's providing leadership and public policy that works for the American people. Guess what? We're not doing it. We're not doing it because for far too long, healthcare has been about politics and not healthcare. The Affordable Care Act is about who's getting stuck with the bill rather than how we can change the outcome for healthcare. And so this is an opportunity. At this point of chaos, this is an opportunity. It's an opportunity for leaders who've been elected to lead to come together and actually begin to solve problems. Before we left, I led a team, 15 of us, over 15 Democrats, came to the floor of the Senate and said, here's some ideas, some things we can do that hopefully will get us through the 18 plan year and that will buy us some time so we can have a broader conversation. That offer fell on deaf ears. And so when people say that Democrats aren't willing to come to the front and answer questions and respond to concerns and talk about what's wrong with healthcare, that is sheer, unadulterated nonsense. And so we have an opportunity, and I am challenging anyone in leadership in the Republican side to drop the structure and the strategy that you have today and to come to the table and work with all of us to answer the questions of a lot of people in our states and in this country who are afraid, scared, mad, and need answers today. And so thanks, Chuck, for all the great work you've done. Thanks, Bob Casey, and I want to call Bob Casey out. No one's been a more diligent protector of people with disabilities. And I thought it was interesting. I had a colleague yesterday, I'll just tell you this story, colleague yesterday who had met with mothers whose children have disabilities. And this woman said to him, she said, they picked on the wrong group of people because 24/7 we have to fight for our kids. It's nothing new for us. And so today, the least among us need our leadership, and let's get it done.